Welcome back to Trigger Point Tuesday. It's Kyle here, and today's going to be a continuation of what we talked about last week. So if you remember, we looked at and we tried to break down a little bit how the ankle obviously affects the knee and how that works directly with the hip. And we talked about all the muscles that come down through this area, and they're basically held in position by some other fascia that runs a little bit different direction. And anytime we start to lose mobility here, then somewhere up the chain ends up paying the price for it. So a lot of times we'll start to see knee pain, can be hip pain, can be back pain, can even be shoulder dysfunction. We really don't know how it's going to perpetuate. We just know that if this right here is not moving the way it should, then something else will pay the price. So here's what we're going to do to address all that area down there. We're going to go back to one of our ultimate six. So the foundation. We're going to start here at the soleus because we know we have to have that strong foundation, proper placement and proper control of the foot as we're moving. So we're going to take our baller block and our TP foot baller. So remember our position here, it's going to be right there on the opposite end. We're going to put it right about that soleus region. So notice I'm 4 to 5 inches above that ankle. This leg goes over the top. So you should be pretty familiar with this, but if you're not, we're revisiting it. So from here, and we're going to add in some stuff. So from here, we're going to do 2 circles to the left, 2 circles to the right. Now, whenever I slide this leg over top to build compression, I'm going to put my foot a little bit further away. So I'm going to get more compression there onto that TP footballer. So from here, 4 knee bends. Big breath in. As a release, we have 1, 2, be sure you're breathing, but I'm not going to cue it each time. 3, 1 more is 4. Now here's where we're going to change it up. We're going to maintain that compression, but now we're going to do a cross friction. 1. So remember, what we're trying to do is separate those fascial layers. We're going to do that 2 times. So we're going across, and now we're going to do a scrub. So again, I'm maintaining compression here, and what I want you to notice is how I'm doing a very small circle. So we're reintroducing that motion in multiple planes of motion. 1, 2, 3, 4. Very good. Now we're going to go to that medial border of the soleus. So internal rotation. Oftentimes feel lots of goodies in there because what we don't realize is that has to stabilize that ankle in a little bit different plane. So from here, 2 circles to the left, 2 circles to the right. Now we're going through the knee bends, building extra compression by reaching out there a little bit further. 1, 2, be sure you're breathing. This is flushing that blood through there. 3, 1 more is 4. Now from here, maintaining compression, cross friction. 1, ooh, this is going to feel good. 3, 1 more is 4. Now maintaining compression again, a nice little scrub. 1, 2, 3, 4. Other direction now. 1, 2, 3, 4. Perfect. So there's our second pass. We're just going to do the 2. If you want that third, you can externally rotate. This is a little bit more focused, so it's going to take you a little bit longer. But if you have some sort of foot and ankle dysfunction, it's definitely worth the time. So we're going through the soleus there. Remember traditional programming, 2 circles in each direction, 4 knee bends, but then we're also adding in cross frictions and then scrubbing motions. Going to separate all that stuff back there so you can move, get some blood flow, get the proper hydration and everything through there. All right, for our next one, we're going to change it up just a bit. So here we're going to take your quad baller and we're going to go after the peroneals. The areas we're going to focus on today are going to be right here at this distal joint. So we're looking at the distal head of the fibula, makes up the ankle, that lateral malleolus. And then we're going to come up and look at this proximal fibular head, makes up the tibiofemoral joint. So from here, what I want you to pay particular attention to, we have that band of fascia that wraps around this way, right? And if anybody's ever sprained their ankle, or if you've ever just felt like your ankle gets jammed up, normally what happens is this part of the fibula down here doesn't move backwards. So whenever we go through dorsiflexion, this should go backwards and this should go forwards. It's a normal type of a seesawing type of motion. Oftentimes that gets stuck. So we're going to try to reintroduce, with some very low-grade pressure, reintroduce that motion. So notice I'm putting this right there on the ankle bone, and notice how my toes here sort of go to the ground. So the foot's relaxed, and I'm at an angle. So from here I'm going to apply, just do this one on yourself, very light pressure forward here, So notice I'm pressing that way. This is trying to press back. And then from here, we're going to look at our traditional programming. So I'm going to go down about an inch, but we're going to work right here in this area. Back up an inch 4 times. There's 1. There's 2, and this will probably be pretty tender. There's 3, and now 1 more here is 4. Now back into that starting position, maintain this pressure, and I want you to get some motion here in your foot. So let's try to dorsiflex up as much as you can 4 times. 1, always keeping that gliding pressure this way. There's 2, be sure you're breathing. There's 3, and 1 more is 4. Perfect. Now continue up the peroneals the way you normally would, working through each zone. And now we're going to jump up here and address right here below the knee, and next week we'll look more at the knee. So if we reintroduced a posterior motion here we have to reintroduce that anterior motion. So for our position, we're going to place right there on that proximal tibiofibular head here, and I'm going to apply a little bit of pressure this way. So we would work through our programming here, so we're going down about an inch, up about an inch, working right over that fibular head. There's 2, 3, and 1 more is 4. Now I want you to stop whenever you're on the fibular head. Don't apply too much pressure, but you're basically right on top of the joint. And you may not even need any pressure at all. Now from this position, you're going to glide your foot backwards, and that's going to apply an anterior shear force onto that area of the joint. So while you're here, just bring the leg back. It's a little bit of knee flexion. Relieve some pressure, go into a little bit of knee extension, apply compression here, and slide back again. We're going to repeat that 4 times. There's 2, there's 3, 1 more here, applying that pressure. There's 4. Perfect. So, didn't want to take up too much of your time today. We addressed the soleus here, added in cross friction and some scrubbing motion, so a mash and a scrub, and then we went right there for that distal part of the tibiofibular joint, so you can see a little bit of redness there where I worked through some of that tissue. Go ahead and go on with your programming to work up the peroneals. Once you get up here, we're going to apply that anterior type of a shear force to reintroduce that proper motion through here. All that fascia gets bound up and stuck every time we try to dorsiflex. All right, so next week we'll address a little bit more with the knee, and then after that we'll go up and look at the hip. I hope you enjoy it. Be sure you leave comments, and happy Trigger Point Tuesday, and keep rolling.